We are excited to introduce Andrea Ubell, Director of Programs and Client Services from Alzheimer's Society of York Region.
Thank you. Thank you very much, everyone. I'm so sorry I can't see you all. I do like seeing the people I'm talking with. So this is certainly strange and unusual times. I'm hoping that my voice is coming through okay and that you're able to hear me. What I thought today we would talk about in this Positive Living Mental Health series for seniors is we would talk a little bit, check in a bit about how your brain is doing during COVID and how to keep your brain healthy during these challenging times. Next slide, please. Next slide. Okay. This I found as a meme. It came through. Some of you may have seen this already. And certainly it explains my mental health over the past 6 long months. You know, I was nice and calm at the beginning. I think most of us went through the panic of toilet paper and various other cleaning products. Now it's, I think, Lysol wipes are hard to get. Then I decided to mask myself and gloves on, everything if I were to go out. I found myself sleeping an awful lot. Certainly that lady in the middle is who I looked like before I had my hair cut. I really thought I was going mad. Then my hair got long and then my hair went gray. And then, like many people, I think instead of COVID-19, we've all gained the COVID-19, which is the 19 pounds we've all put on from eating a lot. Anyway, next slide, please. Now, that's a little bit of humor to start off what I think is a challenging and very difficult time. Fear and stress and worry are all normal and all part of a crisis. And we have been living in a crisis. This pandemic has resulted in so many changes in a very quick time. I'm reminded when I work at the Alzheimer Society, we have staff from all over the world. And I have watched my staff go through episodes. It's been like a wave watching their reactions and COVID spread across the world. So I have had staff with family members in countries and they have lost family members and not able to be with them. Myself, I've got a lot of family down in the United States, down in Michigan and in the Windsor area, and I certainly have not seen any of them. So things are definitely changing. We feel we don't have control. There's a myriad of emotions you've probably all experienced, maybe all at the same time. I know I found myself weeping at times for no known reason. Also hysterically, laughing. And we have to remember too that everybody reacts a little differently. We have some people who are very afraid to leave their home. Other people who are not paying regard to anything. People who feel that they have the right to shame and yell at people who they never would have done these behaviors before. People are afraid for their children, for their grandchildren. How are they going to school? We're worried about our own health. People's financial situations have changed. People are worried about finances and where they're going to be in the future. I know I'm seeing that heightened as the government subsidy now is coming to an end, and people are very worried about how they're going to live. People are isolated, and due to the physical distancing, our normal patterns are not there. People are feeling helpless. They're lonely. Boredom is something we're seeing a lot of as well, which can all have its impact on people. Next slide, please. And I know that I was often feeling quite muddled and still do feel quite muddled, that my brain isn't functioning the way it used to function. I will find myself sitting and staring off for no reason when I've got a mile high of things that I should be doing, but I'm just not able to focus or to concentrate. My sleeping patterns have changed. I think many of you will have found that. And again, this is all normal given the times we're living. What I did find though in May, early in May, and it was an article in Self magazine, which was called, "If you can't get anything done right now, brain fog might be to blame." Next page, please. This article was really, really helpful because it helped me understand why I wasn't able to think clearly. It's basically based on the philosophy or the thoughts of a couple of PhD psychiatrists and psychologists who are talking about, and one of them is Julie Fragg, who in the article talked about having difficulty remembering, forming new thoughts and expressing what we're thinking, this inability to think clearly. She talked about it as a brain fog. She said it's like looking through a frosted window and not being able to see clearly, or watching your internet, as we've all been doing a lot of lately, and that internet connection isn't streaming properly. Another psychologist, Dr. Green, talked about it being exactly as it sounds. We're not clear-headed, we're foggy, we're clouded. This brain fog isn't really a clinical term, but it is a useful way to describe the cognitive impacts that we're seeing and we've been experiencing over the last 6 months. Depression, anxiety, stress, all of this presents with that foggy brain that we have. Next slide, please. I work for the Alzheimer Society, and we certainly are hearing a lot of people describing all of those symptoms. And for many seniors, it brings a fear with it. Is this the start? Am I experiencing the start of Alzheimer's or dementia? What's going on with me? Well, first I wanted to normalize things for you. And I do want to talk about dementia. And in fact, let's talk about dementia. This month, September, is World Alzheimer Awareness Time, or Dementia. World Alzheimer Awareness Month. And on Monday, the 21st of September, is World Alzheimer Day. If you're out and about in York Region, you're going to see many of the municipalities have lit up their flagpoles, the front of their offices, with blue floodlights, because blue floodlights are the signal for Alzheimer's in Canada. And you are going to see those blue lights. I think even the CN Tower might be lighting up blue. So this 21st of September marks the time when we should be talking about dementia. We often don't want to talk about dementia because it has so many stigmas and we're afraid of it. But I think if we are able to start talking about it, it takes it out from the shadows. And it also helps us to understand that there are things that we can do to keep ourselves healthy, to perhaps put off some of the more devastating impacts of the disease. And it talks about us all having to take care of our brains. And I mentioned anxiety and stress and some of the time that we're going through right now. If we do not attend to this, perhaps it could increase our risk of developing dementia down the road. There's some new research that's come out this year that talks about it. Next slide, please. So what we want to talk about are the facts, and I don't want to scare you, but this is something. These are numbers. These are things we need to be aware of. That in the world, in every 3 seconds, there's a new case of dementia that has been diagnosed. It is something that impacts people as we get older. So there is something we can't do about our age getting older. That is one of the risk factors that we cannot have an impact on. Gender is also another impact risk. If you're female more than male, you're more prone to developing dementias. But I will tell you, there are certain things that we can do that can help us prevent it.